medicine, raise your hand. You're not going to find many people, right? Nobody's like, I can't wait to take my medicine. But if you need to take it and you want it to work, you have to take it properly.
Yeah, so Marshall Health clinical pharmacist Sarah Dunaway is here to talk about the importance of medication adherence. Right. Now, this sounds very technical, so what does this mean?
So while medication adherence seems complicated, it's as simple as following the instructions that are on your medication bottle.
That is simple.
Well, okay, so that's, and if you have any questions about it, I guess that's the thing, is that's where you can turn to the professionals, because you shouldn't ever think, well, I think I know what I'm supposed to do. There's no thinking about this. You have to make sure to do it the right way.
Yes, that's correct. And the great thing is Marshall Pharmacy is open 24 hours a day, 365 days a year, so there's always someone you can call and reach out to.
Really?
That's
yes.
great.
I didn't even realize that was available as a service. So what tips do you have when it comes to staying on track for somebody that they want to make sure they stay on track, because it can change sometimes.
It can, especially if you're on maybe an antibiotic and you think, well, I'm feeling great, so I don't need to take the rest of them.
That is a crucial portion of med adherence, is making sure you stay on the proper duration of your medication. So like you said, you may start on antibiotic.
Feeling great.
Yeah.
And that happens a lot.
All the
people
time.
are saying, oh yeah, I feel great, I can just ditch it now.
A doctor will write it for 10 days, about day 5 you're feeling better. Well, the reason you're feeling better is because you have that medication.
It's working.
Exactly.
It's working.
So that's why it's crucial to take it for the full duration that the doctor prescribed it for you.
Yes. Any other tips like that? Because that is a good reminder. And what if you aren't really sure and you hate to bother the doctor? Is it good, like you said, just to reach out to the pharmacist?
Reach out to your local pharmacy team. That's what we're here for. We're always here to help. We're always excited to talk about medications. And actually, many pharmacies offer programs to help patients stay adherent to the medications. At Marshall Pharmacy, we have a program called MedSync, and this is to help minimize the trips to your pharmacy. We will try to get all your prescriptions on the same schedule.
That's nice.
How often do you have to deal with the questions, or maybe just the assumption that people are like, I've been through this before, I know exactly what to do, or my wife has been through this, my husband's been through it, and they think they already know. How important is it to make sure that, because every case is individual, isn't it?
And things are constantly changing. While you think your medications are the same, you have a visit with your doctor, your prescriptions are always changing, the dose may be changing, the interval, the way you take the medication can be changing. That's why it's so important to reach out to your pharmacist, reach out to your provider's office to make sure you do understand the proper way to take your medicines.
Any tips if, let's say, you or a family member happen to have a lot of medications they have to take and keep up with? How can we stay organized?
So one of my favorite things is blister packing.
You brought props?
Yeah, I brought props. This is a great service we offer, and it's basically like a pill pack, but the pharmacy does it for you. So your medications go in these little boxes, and it has the time of day you take it, along with the date, and all you have to do when it's time to take the medicine is punch it right out.
That's wonderful.
And then it's already
you all will put this together.
Yes, we put this together for the patients.
Which is part of the problem. I think that you're asking people to fill their own little med boxes.
Pill boxes with changes that are being made. With, you know, people can't see very good. You may not be able to see the instructions, see how to take the medication.
That camera right there.
So this can be very helpful for patients whenever they're trying to figure out their regimen.
That's a great idea that you all will do it for the patients.
There you go.
Because typically with the pill boxes, I know I have one at home, we still have to do the work and put everything in there and then refill it.
And there's still room for error with that. So every one of these med packs is checked by the pharmacist before it goes out to the patient, so you can feel confident in what you're taking.
Do you find that there's a bit of a stigma with this, where you have younger people who go, I'm not doing that, that's what grandpa does?
I was one of these people, and then I got on multiple medications, and I take different vitamins, and I would forget to take them. So I started doing my own blister packing for myself, so I can stay adherent.
Because it's not always necessarily like, oh, I'm so sick, I need to take this. You're right, there are supplements and things that you want to take on a daily basis. Vitamins. Well, Sarah, thanks for coming in.
This is a great reminder. We've got all the information up there if people want to stop in and visit and talk to the pharmacist and maybe see if they can get started on one of these, you call it blister pack, to remind you to take everything.
Everything you need to know right there, marshall.org/pharmacy, but you can give them a call too, because they're available. 365. That's good. That's a really good service. Sarah, thanks for coming in.
Thank you so much.
Appreciate it.